HESI Nursing Daily Practice Questions. Question 1. A client with chronic obstructive pulmonary disease, COPD, is receiving oxygen therapy. Which assessment finding requires the nurse to take immediate action? Oxygen saturation of 90%. Respiratory rate of 22 breaths per minute. Client reports shortness of breath. Client's respiratory rate decreases to 10 breaths per minute. D. Client's respiratory rate decreases to 10 breaths per minute. Correct answer. The correct answer is D, because a sudden decrease in respiratory rate to 10 breaths per minute in a client with COPD receiving oxygen therapy can indicate respiratory depression or impending respiratory arrest, which are life-threatening emergencies. Immediate action is necessary to prevent further complications. A. An oxygen saturation of 90% is below the normal range but not an immediate concern unless it continues to decrease. B. A respiratory rate of 22 breaths per minute is within the normal range and does not require immediate action. C. Shortness of breath is common in clients with COPD and may not require immediate action unless it is severe or worsening rapidly. Question 2. A client has an oxygen saturation of 88% on room air. Which action should the nurse take first? Initiate oxygen therapy at 2 liters per minute via duct nasal cannula. Place the client in a high Fowler's position. Notify the healthcare provider. Document the finding in the client's medical record. A. Initiate oxygen therapy at 2 liters per minute via duct nasal cannula. Correct answer. The correct answer is A. Initiate oxygen therapy at 2 liters per minute via duct nasal cannula. Oxygen saturation of 88% indicates hypoxemia and requires immediate intervention. Providing supplemental oxygen via nasal cannula will help improve oxygenation. Placing the client in high Fowler's position may help with ventilation, but addressing hypoxemia is the priority. Notifying the healthcare provider is important, but immediate intervention is necessary. Documenting the finding is important but should not delay providing oxygen therapy. Question 3. A client is prescribed albuterol, Proventil, via a metered-dose inhaler. Which action should the nurse take to ensure effective use of this medication? Instruct the client to inhale quickly while administering the medication. Have the client hold their breath for 10 seconds after inhaling the medication. Tell the client to exhale immediately after inhaling the medication. Encourage the client to use the inhaler as needed only when experiencing symptoms. B. Have the client hold their breath for 10 seconds after inhaling the medication. Correct answer. The correct answer is B. Have the client hold their breath for 10 seconds after inhaling the medication. This action promotes medication deposition in the lungs by allowing the albuterol to reach deeper into the airways. Holding the breath for 10 seconds ensures better absorption and effectiveness of the medication. Explanation of incorrect choices. A. Inhaling quickly may cause the medication to not reach the lower airways effectively. C. Exhaling immediately after inhaling the medication can decrease the amount of medication reaching the lungs. D. Using the inhaler only when experiencing symptoms may lead to ineffective management of respiratory conditions. Question 4. A client with chronic obstructive pulmonary disease, COPD, is being assessed by a nurse. Which finding does the nurse expect? Increased anteroposterior, AP, chest diameter. Decreased respiratory rate. Weight gain. Productive cough with yellow sputum. A. Increased anteroposterior, AP, chest diameter. Correct answer. The correct answer is A. Increased anteroposterior, AP, chest diameter. In COPD, the chronic obstruction of airflow leads to air trapping in the lungs, causing the chest to expand more front to back, increased AP diameter. This is known as barrel chest and is a characteristic finding in COPD due to hyperinflation of the lungs. Incorrect choices: B. Decreased respiratory rate is not expected in COPD as patients may have increased respiratory rate due to difficulty breathing. C. Weight gain is not a typical finding in COPD as patients often experience weight loss due to increased energy expenditure and decreased appetite. D. Productive cough with yellow sputum is common in COPD, but it is not the most specific finding for this condition. Question 5. A client is prescribed prednisone for asthma management. Which statement by the client indicates a need for further teaching? I will take this medication every day to prevent asthma attacks. I will avoid people with infections while taking this medication. I will take this medication with food to prevent stomach upset. I will stop taking this medication if I feel fine. D. I will stop taking this medication if I feel fine. Correct answer: the correct answer is D because stopping prednisone abruptly can lead to adrenal insufficiency due to the suppression of the body's natural cortisol production. The client should never stop taking prednisone suddenly without consulting the healthcare provider. Choice A is correct because prednisone is often used as a daily preventive medication for asthma. Choice B is correct as prednisone can lower the immune system, making the client more susceptible to infections. Choice C is incorrect because prednisone is usually taken with food to minimize stomach upset. Question 6. During an acute asthma attack, a healthcare provider assesses a client. Which assessment finding indicates that the client's condition is worsening? Loud wheezing, increased respiratory rate, decreased breath sounds, productive cough. C. Decreased breath sounds. Correct answer: the correct answer is C. Decreased breath sounds. This finding indicates worsening asthma as it signifies decreased airflow to the lungs, which can lead to inadequate oxygenation. Loud wheezing, A, is common in asthma but does not necessarily indicate worsening. Increased respiratory rate, B, is a compensatory mechanism to improve oxygenation. Productive cough, D, may indicate clearing of mucus and is not necessarily associated with worsening asthma. Question 7. A client is wearing a Venturi mask to receive oxygen, and the dinner tray has arrived. What action by the nurse is best? Assess the client's oxygen saturation and, if normal, turn off the oxygen. Determine if the client can switch to a nasal cannula during the meal. Have the client lift the mask off the face when taking bites of food. Turn off the oxygen while the client eats the meal and then restart it. B. Determine if the client can switch to a nasal cannula during the meal. Correct answer: the correct answer is B. Determine if the client can switch to a nasal cannula during the meal. This is the best action because the client can maintain oxygen therapy while eating without the obstruction of the Venturi mask. Switching to a nasal cannula allows for continued oxygen delivery during meals. A. Assessing the client's oxygen saturation and turning off the oxygen if normal is incorrect because the client still needs oxygen support during meals. C. Having the client lift the mask off the face when taking bites of food is incorrect as it disrupts continuous oxygen therapy. D. Turning off the oxygen while the client eats the meal and then restarting it is incorrect as it interrupts oxygen therapy, which should be continuous for clients requiring oxygen support. Question 8. What comfort measure may the nurse delegate to unlicensed assistive personnel, UAP, for a client receiving O2 at 4 liters per nasal cannula? Apply water-soluble ointment to nares and lips. Periodically adjust the oxygen flow rate. Remove the tubing from the client's nose. Turn the client every 2 hours or as needed. A. Apply water-soluble ointment to nares and lips. Correct answer: the correct answer is A. Apply water-soluble ointment to nares and lips. This is an appropriate comfort measure that can be safely delegated to UAP as it helps prevent dryness and irritation caused by the oxygen flow. UAP can apply ointment without adjusting the oxygen flow rate, B, which should be done by licensed staff. Removing the tubing, C, can disrupt oxygen delivery. Turning the client, D, is important for preventing pressure ulcers but is not directly related to oxygen therapy comfort. Question 9. A client with a new tracheostomy is being seen in the oncology clinic. What finding by the nurse best indicates that goals for the nursing diagnosis impaired self-esteem are being met? The client demonstrates a good understanding of stomach care. The client has joined a book club that meets at the library. Family members take turns assisting with stomach care. Skin around the stoma is intact without signs of infection. B. The client has joined a book club that meets at the library. Correct answer. The correct answer is B because joining a book club indicates the client is engaging in social activities and pursuing interests, which can boost self-esteem. Choice A focuses on physical care, not self-esteem. Choice C involves family support, not necessarily self-esteem. Choice D only addresses physical health, not emotional well-being. Overall, engaging in social activities promotes self-worth and a sense of belonging, aligning with the goal of improving self-esteem. Question 10. While assessing a client with a tracheostomy, a nurse notes that the tracheostomy tube is pulsing with the heartbeat during a pulse check. No other abnormal findings are noted. What action should the nurse take? Notify the operating room of a potential emergency case. No action is required at this time. This pulsation can be a normal finding in some clients. Remove the tracheostomy tube and ventilate the client using a bag valve mask. Stay with the client and ask someone else to contact the provider immediately. D. Stay with the client and ask someone else to contact the provider immediately. Correct answer. The correct answer is D. Stay with the client and ask someone else to contact the provider immediately. Rationale: one pulsation of the tracheostomy tube with heartbeat indicates the tube is very close to a major blood vessel. 2. Immediate provider notification is crucial to prevent potential complications. 3. Removing the tube without professional guidance can lead to severe bleeding and airway compromise. 4. Contacting the provider promptly ensures timely intervention and appropriate next steps. Summary: A. Notifying the operating room is premature and unnecessary at this point. B. Pulsation may not always be normal and warrants immediate action. C. Removing the tube without professional guidance can be harmful to the client. Question 11. While caring for a client using O2 in the hospital, what assessment finding indicates that goals for a priority diagnosis are being met? 100% of meals being eaten by the client. Intact skin behind the ears. The client understanding the need for oxygen. Unchanged weight for the past 3 days. B. Intact skin behind the ears. Correct answer. The correct answer is B because intact skin behind the ears indicates proper oxygen delivery, ensuring the client's respiratory needs are being met. This assessment finding shows that the oxygen therapy is effective in improving oxygenation. A. This choice is incorrect as the client's meal intake does not directly reflect the effectiveness of oxygen therapy. C. Although important, the client's understanding of the need for oxygen does not directly indicate the success of the oxygen therapy. D. Unchanged weight is not a direct indicator of the effectiveness of oxygen therapy in this situation. Question 12. A student is practicing suctioning a tracheostomy in the skills laboratory. What action by the student demonstrates that more teaching is needed? Applying suction while withdrawing the catheter. Pre-oxygenating the client before suctioning. Suctioning up to 3 times if necessary. Suctioning for a duration of 10 to 15 seconds each time. A. Applying suction while withdrawing the catheter. Correct answer. The correct answer is A. When suctioning a tracheostomy, the student should not apply suction while withdrawing the catheter to prevent mucosal damage. The correct technique involves inserting the catheter without applying suction, then withdrawing it while applying suction. This helps to clear secretions effectively without causing trauma. Choices B, C, and D are incorrect. Pre-oxygenating the client is a recommended practice to prevent hypoxemia during suctioning. Suctioning up to 3 times if necessary and suctioning for 10 to 15 seconds each time are appropriate techniques to clear secretions effectively without causing harm. Question 13. A nursing student is providing tracheostomy care. What action by the student requires intervention by the instructor? Holding the device securely when changing ties. Suctioning the client first if secretions are present. Tying a square knot at the back of the neck. Using half-strength peroxide for cleansing. C. Tying a square knot at the back of the neck. Correct answer. The correct answer is C. Tying a square knot at the back of the neck. The reason this action requires intervention is that a square knot is not recommended for securing tracheostomy ties as it can be difficult to untie in an emergency. Instead, a quick release knot or Velcro closure is typically used for easy removal. A. Holding the device securely when changing ties is important for maintaining the integrity of the tracheostomy. B. Suctioning the client first if secretions are present is a standard practice to ensure clear airways. D. Using half-strength peroxide for cleansing is appropriate for tracheostomy care to prevent infection. In summary, the incorrect choice is C because tying a square knot can pose risks in an emergency situation, while the other choices are appropriate actions in tracheostomy care. Question 14. A client with a tracheostomy experienced a coughing spell during a meal that was being fed by an unlicensed assistive personnel, UAP. What action by the nurse takes priority? Assess the client's lung sounds. Assign a different UAP to the client. Report the UAP to the manager. Request thicker liquids for meals. A. Assess the client's lung sounds. Correct answer. The correct answer is A. Assess the client's lung sounds. This action takes priority because the client experienced a coughing spell, indicating a potential aspiration risk. Assessing lung sounds can help determine if there is any respiratory distress or compromised airway. B. Assigning a different UAP does not address the immediate concern of the client's respiratory status. C. Reporting the UAP to the manager may be necessary but is not the immediate priority when the client's health is at risk. D. Requesting thicker liquids for meals does not address the client's current condition and may not be appropriate without proper assessment. Question 15. A client has a tracheostomy tube in place. When the nurse suctions the client, food particles are noted. What action by the nurse is best? Elevate the head of the client's bed. Measure and compare cuff pressures. Place the client on NPO status. Request a swallow study for the client. B. Measure and compare cuff pressures. Correct answer. Correct answer. B. Rationale. 1. Tracheostomy cuff should be inflated to prevent aspiration. 2. Food particles indicate cuff leakage. 3. Measuring cuff pressure ensures proper sealing. 4. Prevents aspiration and respiratory complications. Summary. A. Elevating the head is beneficial but doesn't address cuff leakage. C. NPO status is extreme and unnecessary without confirmation of aspiration risk. D. Swallow study is for assessing swallowing function, not related to cuff pressure. Question 16. A client has a tracheostomy that is 3 days old. Upon assessment, the nurse notes the client's face is puffy, and the eyelids are swollen. What action by the nurse takes priority? Assess the client's oxygen saturation. Notify the rapid response team. Oxygenate the client with a bag valve mask. Palpate the skin of the upper chest. A. Assess the client's oxygen saturation. Correct answer. The correct answer is A. Assess the client's oxygen saturation. This is the priority because the client's puffy face and swollen eyelids may indicate airway obstruction or respiratory distress, common complications in tracheostomy patients. Assessing oxygen saturation helps determine if the client is getting enough oxygen. Option B, notify the rapid response team, is not the immediate action unless the client's condition deteriorates rapidly. Option C, oxygenate the client with a bag valve mask, may be necessary but should come after assessing oxygen saturation. Option D, palpate the skin of the upper chest, is irrelevant to the client's current symptoms. Question 17. A client is scheduled to have a tracheostomy placed in an hour. What action by the nurse is the priority? Administer prescribed anxiolytic medication. Ensure informed consent is on the chart. Reinforce any teaching done previously. Start the preoperative antibiotic infusion. B. Ensure informed consent is on the chart. Correct answer. The correct answer is B. Ensure informed consent is on the chart. This is the priority because obtaining informed consent is essential to ensure the client understands the procedure, risks, benefits, and alternatives. It protects the client's autonomy and ensures legal and ethical standards are met. Administering anxiolytic medication may help with anxiety but does not address the crucial issue of consent. Reinforcing teaching and starting antibiotics are important but secondary to obtaining informed consent. Question 18. The client is prescribed a long-acting beta-2 agonist and expresses concerns about the cost, stating they only use the inhaler during asthma attacks. How should the nurse respond? Explain the importance of using the inhaler daily to prevent asthma attacks. Suggest identifying community services to help with the cost and encourage daily use of the inhaler. Explore the client's fears regarding breathlessness. Emphasize the necessity of using this inhaler daily and discuss potential community services for financial assistance. B. Suggest identifying community services to help with the cost and encourage daily use of the inhaler. Correct answer. Step 1. The nurse must acknowledge the client's concern about the cost of the inhaler. Step 2. Suggesting community services shows empathy and addresses the financial aspect. Step 3. Encouraging daily use aligns with the standard treatment guidelines. Step 4. By addressing both cost and importance of daily use, the nurse promotes adherence and support. Summary of other choices. A. Incorrect. This option doesn't address the client's financial concerns. C. Incorrect. Focusing on fears of breathlessness doesn't directly address the client's cost concern. D. Incorrect. While discussing daily use is important, not directly addressing the cost concern may lead to non-adherence. Question 19. A client with chronic obstructive pulmonary disease, COPD, appears thin and disheveled. Which question should the nurse ask first? Do you have a strong support system? What do you understand about your disease? Do you experience shortness of breath with basic activities? What medications are you prescribed to take each day? C. Do you experience shortness of breath with basic activities? Correct answer. The correct question to ask first is C. Do you experience shortness of breath with basic activities? This is because shortness of breath is a common and concerning symptom in COPD patients that can greatly impact their quality of life and indicate disease progression. By addressing the symptom first, the nurse can assess the severity of the client's condition and determine the immediate need for intervention or treatment. Asking about support system, A, is important but not as urgent as addressing the primary symptom. Inquiring about the client's understanding of the disease, B, and medications, D, is also important but should come after addressing the immediate symptom of shortness of breath. Question 20. A nurse is interested in providing community education and screening on hypertension. In order to reach a priority population, to what target audience should the nurse provide this service? African American churches, Asian American groceries, high school sports camps, women's health clinics. A. African American churches. Correct answer. The correct answer is A. African American churches. This target audience is appropriate because African Americans have a higher prevalence of hypertension compared to other ethnic groups. By providing education and screening at African American churches, the nurse can reach a population that is at higher risk for hypertension. Churches are also community hubs where individuals gather regularly, making it an effective platform for health promotion. Choice B, Asian American groceries, is incorrect as it does not specifically target a population with a high prevalence of hypertension. Choice C, high school sports camps may not be an ideal target audience for hypertension education as the focus is typically on physical fitness rather than chronic disease management. Choice D, women's health clinics may not reach the priority population of African Americans who have a higher prevalence of hypertension. Question 21. A nursing student asks what essential hypertension is. What response by the registered nurse is best? It means it is caused by another disease. It means it is essential that it be treated. It is hypertension with no specific cause. It refers to severe and life-threatening hypertension. C. It is hypertension with no specific cause. Correct answer. The correct answer is C. It is hypertension with no specific cause. Rationale. 1. Essential hypertension is also known as primary or idiopathic hypertension. 2. It is the most common type of hypertension, accounting for about 90 to 95% of cases. 3. The exact cause of essential hypertension is unknown, but it is believed to be due to a combination of genetic, environmental, and lifestyle factors. 4 choices A, B, and D are incorrect because essential hypertension is not caused by another disease, does not necessarily require treatment as essential means fundamental, and is not specifically severe or life-threatening. Question 22. A client has been diagnosed with hypertension but does not take the antihypertensive medications because of a lack of symptoms. What response by the nurse is best? Do you have trouble affording your medications? Most people with hypertension do not have symptoms. You are lucky. Most people get severe morning headaches. You need to take your medicine or you will get kidney failure. B. Most people with hypertension do not have symptoms. Correct answer. Step-by-step rationale. 1. Choice B is correct because it educates the client that hypertension often presents without symptoms. 2. Lack of symptoms does not mean the condition is not serious. 3. This response promotes understanding and adherence to medication. 4 choices A, C, and D are incorrect as they do not address the main issue of hypertension being asymptomatic. Question 23. A client takes atorvastatin, Lipitor, with laboratory results showing a blood urea nitrogen, BUN, of 33 mg/dl and creatinine of 2.8 mg/dl. What action by the nurse is best? Ask if the client eats grapefruit. Assess the client for dehydration. Facilitate admission to the hospital. Obtain a random urinalysis. A. Ask if the client eats grapefruit. Correct answer. The correct answer is A. Ask if the client eats grapefruit. Atorvastatin can interact with grapefruit juice, leading to increased drug levels and potential toxicity. The elevated BUN and creatinine levels suggest possible kidney impairment, which could be exacerbated by the drug interaction. Assessing for grapefruit consumption allows the nurse to address this potential risk factor. B. Assessing for dehydration would not directly address the potential drug interaction with grapefruit. C. Hospital admission is not necessary based solely on the information provided. This would be an extreme action without further assessment. D. Obtaining a random urinalysis would not provide relevant information related to the potential drug interaction with grapefruit. Question 24. A nurse is evaluating a 3-day diet history with a client who has an elevated lipid panel. What meal selection indicates the client is managing this condition well with diet? A 4-ounce steak, French fries, iceberg lettuce, baked chicken breast, broccoli, tomatoes, fried catfish, cornbread, peas, spaghetti with meat sauce, garlic bread. B. Baked chicken breast, broccoli, tomatoes. Correct answer. The correct answer is B because it includes a lean protein, baked chicken breast, and high fiber vegetables, broccoli, tomatoes, which are beneficial for managing elevated lipid levels. Lean protein helps reduce saturated fat intake while fiber from vegetables aids in lowering cholesterol levels. Choice A includes a high saturated fat steak and French fries, not ideal for managing lipid levels. Choice C contains fried catfish and cornbread, which are high in unhealthy fats and refined carbohydrates. Choice D has spaghetti with meat sauce and garlic bread, which are high in refined carbohydrates and saturated fats, not recommended for someone with elevated lipid levels. Question 25. A healthcare professional is caring for 4 clients on intravenous heparin therapy. Which lab value possibly indicates a serious side effect has occurred? Hemoglobin, 14.2 g/dl. Platelet count, 82,000/L. RBC count, 4.8 x 10^6/L. WBC count, 8.7 x 10^3/L. B. Platelet count, 82,000/L. Correct answer. The correct answer is B. Platelet count, 82,000/L. A low platelet count, thrombocytopenia, is a serious side effect of heparin therapy, as it can lead to bleeding complications. Platelets are essential for normal blood clotting. Hemoglobin, RBC count, and WBC count are not directly affected by heparin therapy and do not indicate a serious side effect.